Okay, picture this. It's 2 p.m. on a Tuesday. You are, what, 3 charts behind? Your coffee is completely room temperature, and your patient looks at you, laughs nervously, and drops this exact quote. You're probably going to think this is weird, but I saw on TikTok that taking Pepcid with Allegra can help menopause brain fog and hot flashes. You know the feeling, right? Because in today's medical landscape, somewhere between beef organ supplements and cortisol mocktails, TikTok Said So has essentially become a secondary peer-reviewed journal for our patients. Welcome to the Explainer, decoding the viral Pepcid and Allegra menopause hack. Look, I completely get it. I know the immediate temptation when you hear a social media hack is to just roll your eyes and move on. We're burned out, we're busy, and honestly, we just don't have time for internet medicine. But here's the thing, dismissing patients is lazy medicine. Curiosity is almost always more productive than an eye roll. And sometimes these weird internet rabbit holes actually hide some incredibly important clinical nuance. So we're going to decode exactly why the internet thinks allergy meds cure menopause and what it actually teaches us about our midlife patients. Let's get into it. I mean, really? Is perimenopause the Marie Kondo junk drawer of medicine? Because to understand how we got here, we have to acknowledge a pretty hard truth about midlife women's health. Perimenopause has basically become exactly that, a junk drawer. Are you hot? Menopause. Anxious? Menopause. Heart racing? Menopause. Literally can't remember your passwords to save your life? Must be menopause. Suddenly flushing after half a glass of wine and feeling allergic to your own existence? Yep, we just toss it all right into the menopause bucket. But we really need to ask ourselves, is it always just ovarian aging? Section 1. The origin, enter the feral goblin. To figure out how this specific rumor started, we have to look at the wellness world's absolute obsession with Mast Cell Activation Syndrome, or MCAS, and histamine intolerance. Now, unlike a lot of wellness trends out there, this one actually has legitimate immunologic roots. But let's be crystal clear right off the gate. There is zero clinical evidence supporting the use of famotidine, which is Pepcid, combined with fexofenadine, which is Allegra, for menopause guidelines. No randomized trials. Zilch. It is completely absent from ACOG guidelines and Menopause Society recommendations. So if there's literally zero evidence, why on earth are millions of women convinced it works? Well, it all comes down to the internet completely misunderstanding our body's most chaotic molecule. Meet histamine. Histamine is one of those molecules that behaves like it literally drank 3 espressos and woke up choosing violence. It creates absolute drama across multiple organ systems simultaneously through 4 different receptor subtypes. Now, in actual diagnosed mast cell disorders, blocking these receptors is real evidence-based medicine. It's not a hack, it's the standard of care. But how exactly did the internet connect this to menopause? Well, here's the biological plausibility that tricked everyone. We've got H1 receptors. These are your allergy chaos coordinators. They cause the itching, the runny nose, the flushing. Then you have H2 receptors, the ones Pepcid actually targets. They're famous for stomach acid, sure, but they also participate in vasodilation and flushing. On top of that, histamine actually plays a role in hypothalamic thermoregulation. So, social media collectively went, wait a second. Flushing involves histamine. Histamine affects body temperature. Hot flashes involve temperature. What if Pepcid fixes menopause? I mean, the logic isn't totally insane, right? But biologic plausibility is definitely not clinical evidence. Section 2. The physiology plot twist. Because listen, if biologic plausibility were enough, half our patient supplement cabinets would already have FDA approval. So here is a massive clinical pearl to remember. Menopause is not a histamine disorder. Period. Routine menopausal vasomotor symptoms are primarily driven by neuroendocrine thermostat dysfunction related to estrogen withdrawal. If you want to actually fix the problem, you really have to understand the hardware that's malfunctioning. Enter the KNDy neurons. These are specialized hypothalamic neurons named for the neurotransmitters they express: kisspeptin, neurokinin B, and dynorphin. Honestly, just think of them as the tiny thermostat gremlins running the show up in the hypothalamus. Under normal premenopausal estrogen conditions, these neurons keep the body's thermoneutral zone perfectly stable. They're calm, they're regulated, everything is fine. But then the cascade hits. Step 1, estrogen levels decline. Step 2, this withdrawal alters the KNDy neuron activity, causing neurokinin B signaling to absolutely spike. Step 3, the thermoneutral zone narrows dramatically. This means tiny changes in core body temperature, changes that your patient's younger ovaries would have totally ignored with the emotional stability of a well-rested golden retriever, now trigger step 4, a massive heat dissipation response. Sudden, infernal-level oversheeting, sweating, peripheral vasodilation. Bam. That is a hot flash. It is a busted thermostat, not an allergy. Section 3. Why the hack fails pharmacologically. Okay, now that we know the actual mechanism, let's dismantle this TikTok hack using basic, undeniable pharmacology, because you need to be equipped to explain this simply and clearly on your very next clinical shift. Let's look at Pepcid, famotidine. Its FDA labeling notes 0 clinically significant CNS or endocrine effects. Yes, sure, there was one intriguing preclinical study suggesting famotidine might have an anti-inflammatory effect in mouse cytokine storm models, and the internet did what the internet always does. It essentially emotionally support-animaled a preclinical finding into a cure for everything. But guys, a mouse cytokine storm model is not your sweaty perimenopausal lawyer who just forgot where she parked her SUV at Costco. It's just not evidence for treating human vasomotor symptoms. And then there's Allegra. Reality check time. Fexofenadine presents an even bigger mechanistic issue. It is a second-generation H1 inverse agonist that is specifically engineered to not cross the blood-brain barrier. PET imaging shows essentially 0 central H1 receptor occupancy. I mean, that is its entire selling point. It doesn't make you sleepy. So pharmacologically speaking, using Allegra to cure menopause brain fog makes about as much sense as watering a houseplant to try and improve your Wi-Fi signal. It will not improve cognitive dysfunction. It is simply the wrong target and the completely wrong mechanism. Section 4. The MCAS plot twist. But wait, here is the curiosity loop payoff. The internet isn't entirely wrong. While antihistamines absolutely won't fix routine menopause, some of these patients claiming this hack literally changed their lives, they might not actually be experiencing routine menopause at all. Mast Cell Activation Syndrome can absolutely masquerade as perimenopause. If your midlife patient presents with episodic flushing, unexplained urticaria, severe GI symptoms, tachycardia, huge drops in blood pressure, or temperature instability that feels completely disproportionate to typical vasomotor symptoms, those are massive red flags. That kind of multisystem inflammatory chaos deserves a much broader differential diagnosis than just telling her, well, your ovaries are retiring. So the real takeaway here actually validates your diagnostic skills. We have to avoid reflexively attributing every single flushing syndrome in midlife women to ovarian aging alone. When a patient sits across from you and says an antihistamine protocol cured their menopause, they might actually be telling you that they finally, inadvertently, treated their undiagnosed mast cell disorder. Sometimes the body is just telling a much more complicated story, and it is our job to catch it. Section 5. Evidence-based clinical pearls. Now, for the vast majority of your patients who do just have routine menopausal vasomotor symptoms, let's land the plane with the actual data. Hormone therapy, specifically estrogen, remains the absolute gold standard, giving us roughly a 75% reduction in hot flashes. For non-hormonal options, SSRIs and SNRIs give us a solid 40 to 65% reduction in symptoms. But you guys, the real game changer right now is NK3 antagonists, like fezolinetant. This is mechanistically elegant medicine, because instead of just throwing pharmacologic spaghetti at the wall to see what sticks, we are finally directly targeting the KNDy neuron pathway, that specific hypothalamic circuitry driving the thermostat dysfunction. This right here is what modern targeted menopause care actually looks like. The truth is, women are suffering out there, and modern medicine's historical dismissal of that suffering created a massive vacuum that social media was all too happy to fill. So when you see your next patient who nervously brings up a bizarre TikTok hack, I want you to remember this quote. The goal is not to be a dismissive skeptic, it's to be an excellent diagnostician. Validate them, stay anchored to the evidence, and give them the targeted relief they actually deserve. But it really does beg the question, if social media is diagnosing our patients' complex immune disorders before we are, what other systemic blind spots are just sitting there hiding in our waiting rooms? Keep learning, stay curious, and I'll catch you in the next explainer.